Question 1. A social worker is conducting an intake with a new client who reports feeling overwhelmed by stress, difficulty sleeping, and persistent sadness following a recent job loss. The client has no prior history of mental health treatment. What is the first action the social worker should take? A. Develop a safety plan with the client. B. Refer the client to a psychiatrist for medication evaluation. C. Complete a comprehensive biopsychosocial assessment. D. Provide the client with coping strategies for stress management. Answer: C. Complete a comprehensive biopsychosocial assessment. This question tests the foundational principle of starting with a thorough understanding of the client's situation. The keyword first indicates the initial, most crucial step. A comprehensive biopsychosocial assessment gathers all necessary information across various life domains, allowing the social worker to understand the client's current challenges, strengths, and needs holistically before determining appropriate interventions. Jumping straight to interventions or referrals without this foundational assessment could lead to misdiagnosis or ineffective support. For instance, a client's sadness might stem from financial strain rather than clinical depression, which the assessment would uncover. Always remember to assess thoroughly before intervening. Question 2. A social worker in a community mental health setting learns that a colleague is regularly coming to work under the influence of alcohol. What is the best action for the social worker to take? A. Ignore the behavior, as it is a personal matter of the colleague. B. Confront the colleague privately and advise them to seek help. C. Document the observations and report the concerns to a supervisor. D. Discuss the issue with other colleagues to gather their opinions. Answer: C. Document the observations and report the concerns to a supervisor. This question addresses ethical responsibility and professional conduct within an agency setting. The keyword best implies seeking the most appropriate and effective course of action that upholds ethical standards and ensures client safety. While confronting the colleague privately might seem helpful, the primary responsibility of a social worker in this situation is to protect clients and uphold professional standards, which is achieved by reporting the issue through appropriate supervisory channels. The supervisor can then ensure the colleague receives help and that client care is not compromised, following agency policy. Remember that protecting clients and maintaining professional integrity always takes precedence. Question 3. A 15-year-old client often expresses intense anger towards their parents, but when confronted, the client claims that their parents are always angry and that they are just reacting to it. This defense mechanism is an example of A. Rationalization. B. Sublimation. C. Projection. D. Reaction formation. Answer: C. Projection. This question focuses on identifying a common defense mechanism. The clue lies in the client attributing their own unacceptable feelings, anger, to others, their parents, rather than acknowledging them in themselves. Projection involves unconsciously displacing one's own unacceptable thoughts or feelings onto another person. For example, someone who is insecure about their intelligence might accuse others of being unintelligent. Understanding these mechanisms helps social workers recognize underlying issues and develop appropriate therapeutic strategies. When a client claims everyone else feels a certain way they themselves feel, consider projection. Question 4. A client, recently diagnosed with a terminal illness, consistently tells their social worker, "This can't be happening to me, there must be a mistake." According to Elizabeth Kubler-Ross's stages of grief, the client is most likely experiencing which stage? A. Bargaining. B. Anger. C. Depression. D. Denial. Answer D. Denial. This question tests knowledge of Kubler-Ross's stages of grief, a core concept in understanding reactions to loss. The statement, "This can't be happening to me," is a classic indicator of denial, where an individual refuses to accept the reality of a painful fact or situation. Denial serves as a temporary defense mechanism, helping individuals cope with the initial shock of a devastating diagnosis or loss. For instance, a person might continue planning future events despite a terminal diagnosis. Remember that denial is often the first buffer against overwhelming news, buying time to process the information. Question 5. A social worker is meeting with a client who reports experiencing visual hallucinations and disorganized thoughts. The client states they have recently started taking a new medication. The social worker reviews the client's medication list and sees risperidone. The social worker understands this medication is primarily used to treat A. Anxiety disorders, B. Bipolar disorder, C. Psychotic disorders, D. Major depressive disorder. Answer C. Psychotic disorders. This question assesses knowledge of psychopharmacology, specifically common medications for mental health conditions. Risperidone is an antipsychotic medication, typically prescribed to manage symptoms of psychotic disorders such as schizophrenia, which include hallucinations and disorganized thoughts. Recognizing the primary use of medications like risperidone helps social workers understand the client's treatment plan and potential side effects, enabling more informed support and collaboration with medical professionals. For example, knowing a client is on an antipsychotic helps the social worker understand the client's baseline symptoms and potential for improvement or side effects. Always link symptoms to potential medication types. Question 6. During a home visit, a social worker observes significant safety hazards, including exposed wiring, overflowing trash, and a strong smell of animal waste, in the home of an elderly client who lives alone. The client refuses any assistance or changes, stating they are fine. What is the next action the social worker should take? A. Respect the client's autonomy and close the case. B. Contact Adult Protective Services, APS, to report suspected self-neglect. C. Schedule another home visit to persuade the client to accept help. D. Provide the client with information on local cleaning services. Answer B. Contact Adult Protective Services, APS, to report suspected self-neglect. This question addresses the balance between client autonomy and the social worker's ethical duty to protect vulnerable adults. The presence of significant safety hazards and the client's refusal of help strongly suggests self-neglect, which is a reportable condition. The next action, after assessing the immediate risk, is to involve the appropriate protective services to ensure the client's safety, as the client's capacity for informed decision-making might be compromised by the conditions. For example, if a client is living in conditions that pose a serious risk to their health, reporting to APS ensures a formal investigation into their well-being. Prioritize safety when a vulnerable client cannot, or will not, protect themselves. Question 7. A social worker is working with a client who expresses extreme distress about an upcoming job interview, stating, "I'm going to fail, I know it. I always mess everything up." The social worker notices the client is consistently focusing on negative outcomes despite positive past experiences. This cognitive distortion is an example of A. All or nothing thinking, B. Catastrophizing, C. Overgeneralization, D. Personalization. Answer C. Overgeneralization. This question tests the ability to identify common cognitive distortions, which are often targeted in cognitive behavioral therapy. The client's statement, "I always mess everything up," demonstrates taking a single negative event and applying it broadly to all situations, even when evidence doesn't support it. Overgeneralization involves drawing a sweeping conclusion based on one or two isolated incidents. For example, if a student fails one exam and then believes they will fail every future exam, that's overgeneralization. Help clients challenge these broad, negative conclusions. Question 8. A client has been referred for services due to recent outbursts of anger and aggression at home. During the initial session, the client expresses deep remorse for their actions and states a desire to learn healthier coping mechanisms. What is the best initial goal to establish with this client? A. Eliminate all anger and aggressive behaviors immediately. B. Explore the underlying causes of the client's anger. C. Develop and practice alternative coping strategies for managing anger. D. Refer the client to anger management group therapy without further assessment. Answer: C. Develop and practice alternative coping strategies for managing anger. This question focuses on establishing realistic and client-centered goals in the initial stages of intervention. The best initial goal should be actionable, measurable, and directly address the client's expressed desire for change. While exploring underlying causes is important, focusing on immediate skill building provides the client with tools to manage their presenting problem, which aligns with their desire to learn healthier coping mechanisms. For example, teaching a client to use I statements instead of yelling during conflict provides a tangible coping strategy. Prioritize tangible skills that empower the client to address their immediate concerns. Question 9. A client receiving treatment for substance use disorder regularly attends group therapy and expresses a strong desire to maintain sobriety. However, they frequently miss individual sessions and struggle to follow through with homework assignments. The social worker observes that the client often blames external factors for their missed appointments. This behavior is most consistent with which stage of change? A. Pre-contemplation. B. Contemplation. C. Preparation. D. Action. Answer: B. Contemplation. This question assesses understanding of the trans-theoretical model, stages of change. The client expresses a desire for sobriety and attends group therapy, some acknowledgement of the problem, but inconsistent follow-through and blaming external factors suggest ambivalence and a lack of full commitment to action. In the contemplation stage, individuals are aware of a problem and seriously considering changing, but they haven't yet committed to taking action and often weigh the pros and cons of change. For example, someone contemplating quitting smoking might talk about it often but hasn't set a quit date. Look for signs of thinking about it but not fully doing it. Question 10. A social worker is facilitating a support group for survivors of domestic violence. One group member consistently dominates the discussion, frequently interrupts others, and offers unsolicited advice. What is the most appropriate action for the social worker to take? A. Allow the member to continue, as they are actively participating. B. Privately confront the member after the group session about their behavior. C. Redirect the discussion and gently remind the group of the guidelines for respectful communication. D. Ask the other group members to address the dominating member. Answer: C. Redirect the discussion and gently remind the group of the guidelines for respectful communication. This question addresses group facilitation skills and managing challenging group dynamics. The most appropriate action is to address the behavior in a way that maintains the group's therapeutic environment and promotes respectful interaction without shaming or singling out an individual. Gently reminding the entire group of established norms for respectful communication redirects the dominant member while empowering other members to participate. For example, the social worker might say, Thank you for sharing. Member's name. Let's ensure everyone has a chance to speak, and remember to listen actively. Maintain group balance and respect through gentle, clear reminders. Question 11. A social worker is providing grief counseling to a client whose spouse recently passed away. The client expresses guilt, stating, "I should have done more to prevent their illness." This feeling is a common component of the grief process. What is the best response from the social worker? A. You shouldn't feel guilty, it wasn't your fault. B. Tell me more about those feelings of guilt. C. Many people feel that way, it's a normal part of grief. D. Let's focus on the positive memories you shared. Answer, B. Tell me more about those feelings of guilt. This question tests active listening and therapeutic communication skills in the context of grief. The best response is one that validates the client's feelings and encourages further exploration, allowing the client to fully express their emotions without judgment or immediate reassurance. Asking for more details about the guilt helps the social worker understand its roots and allows the client to process their complex emotions. Simply dismissing the feeling or normalizing it too quickly can inadvertently shut down the client's expression. Always create space for clients to explore and articulate their feelings. Question 12. A 7-year-old child client consistently struggles with making friends, often exhibits impulsive behaviors, and has difficulty paying attention in school. These symptoms have been present for over 6 months and significantly impact the child's academic and social functioning. What condition should the social worker first consider assessing for? A. Oppositional defiant disorder, ODE. B. Generalized anxiety disorder, GAD. C. Attention deficit/hyperactivity disorder, ADD. D. Autism spectrum disorder, ASD. Answer, C. Attention deficit/hyperactivity disorder, ADD. This question requires linking presented symptoms to a likely diagnosis, especially when considering initial assessment. The combination of difficulty making friends, social impact, impulsive behaviors, and difficulty paying attention in school, persisting for over 6 months and impacting multiple areas, strongly points towards attention deficit/hyperactivity disorder, ADD. While other disorders might share some symptoms, this specific cluster is highly characteristic of ADHD, particularly in childhood. An initial assessment would aim to rule in or out this primary consideration before exploring others. When seeing a cluster of inattention, hyperactivity, and impulsivity, think ADHD. Question 13. A social worker receives a subpoena requesting confidential client records for a court case. The client has not provided consent for the release of information. What is the first action the social worker should take? A. Immediately release the records as requested by the subpoena. B. Contact the client to discuss the subpoena and seek their informed consent. C. Consult with a legal expert or the agency's legal counsel. D. Object to the subpoena on the grounds of client confidentiality. Answer, B. Contact the client to discuss the subpoena and seek their informed consent. This question deals with ethical and legal obligations regarding client confidentiality and subpoenas. The first action is to involve the client, as their privacy rights are paramount. Discussing the subpoena with the client allows them to understand the request and provide informed consent for the release of information, or to refuse consent. If the client refuses, the social worker would then typically consult legal counsel or the court to determine the next steps, often advocating to quash or limit the subpoena. Always prioritize the client's right to privacy and self-determination when confidential information is requested. Question 14. A client expresses to their social worker that they feel intense anxiety whenever they are in crowded public places, leading them to avoid such situations entirely. This fear has significantly impacted their ability to attend social gatherings and run errands. This is most consistent with symptoms of A. Specific phobia. B. Social anxiety disorder. C. Agoraphobia. D. Panic disorder. Answer: C. Agoraphobia. This question tests the ability to differentiate between anxiety disorders based on specific symptom presentations. The key indicators are intense anxiety in crowded public places and the resulting avoidance of such situations entirely, which significantly impacts daily functioning. Agoraphobia is characterized by a fear of situations where escape might be difficult or help unavailable, leading to avoidance of public transportation, open spaces, enclosed spaces, standing in line, or being in a crowd. While other anxiety disorders involve fear, the pervasive avoidance of multiple public settings points to agoraphobia. When avoidance of various public places is the primary concern, consider agoraphobia. Question 15. A social worker is conducting a biopsychosocial assessment with an adolescent client. The client repeatedly avoids eye contact, speaks in a monotone voice, and gives very brief answers, often shrugging their shoulders. This nonverbal communication is an example of which aspect of the mental status examination? A. Thought process. B. Mood. C. Affect. D. Insight. Answer: C. Affect. This question focuses on components of the mental status examination, a crucial assessment tool. The client's lack of eye contact, monotone voice, brief answers, and shrugs all relate to the expression of emotions and overall emotional responsiveness, which is what affect refers to. Affect is the observable expression of emotion, such as a flat, blunted, or constricted affect. Mood, by contrast, is the sustained emotional state reported by the client. For example, a client might report a depressed mood but have a blunted affect. Distinguish between the subjective mood and the objective, observed affect. Question 16. A social worker is providing services to a family experiencing significant conflict. During a family session, one parent consistently blames the other parent for all family problems, refusing to acknowledge any personal contribution. This pattern of interaction is an example of A. Enmeshment. B. Triangulation. C. Scapegoating. D. Disengagement. Answer: C. Scapegoating. This question addresses common dysfunctional family dynamics. The described behavior, where one parent unfairly places all blame on the other for family problems, is a classic example of scapegoating. Scapegoating occurs when one person or group is singled out for unmerited blame, often to avoid confronting the real issues or the contributions of other family members. For instance, a child might be blamed for all family stress, even when marital conflict is the true root. Identifying scapegoating helps the social worker reframe the problem and encourage shared responsibility within the family system. Question 17. A social worker is working with an adult client who was recently diagnosed with a serious medical condition. The client states, "I'm going to beat this, I'll exercise every day and completely change my diet, and then I'll be fine." While positive, the social worker recognizes this as a potential defense mechanism. This could be an example of A. Intellectualization. B. Compensation. C. Reaction formation. D. Undoing. Answer: D. Undoing. This question asks to identify a defense mechanism in response to a threatening situation. The client's extreme, almost magical thinking about undoing the illness through rigorous behavior changes, in an attempt to negate the reality of the diagnosis, aligns with the defense mechanism of undoing. Undoing involves an attempt to symbolically negate a previous act or thought, often by adopting a new, opposite behavior. For example, a person who feels guilty about an unkind comment might then lavish the person with gifts. While positive behaviors are good, if they are solely driven by an unconscious need to reverse an unpleasant reality, it's worth noting the underlying dynamic. Question 18. A client experiencing symptoms of depression reports feeling hopeless and expresses suicidal ideation without a specific plan. What is the first and most critical action the social worker should take? A. Encourage the client to focus on positive thoughts and activities. B. Contact the client's emergency contact to inform them of the situation. C. Conduct a thorough suicide risk assessment. D. Refer the client to an outpatient therapy group. Answer: C. Conduct a thorough suicide risk assessment. This question deals with a critical situation involving client safety. When a client expresses suicidal ideation, even without a specific plan, the first and most critical action is always to conduct a comprehensive suicide risk assessment. This assessment helps determine the level of risk, presence of protective factors, and informs immediate safety planning, which is paramount. Without a full assessment, the social worker cannot appropriately intervene or refer the client safely. For example, the assessment would explore the client's intent, access to means, and history of attempts. Always assess risk fully and immediately when suicide ideation is present. Question 19. A social worker is working with a parent who describes their 3-year-old child as being very attached, often crying when the parent leaves the room, and hesitant to explore new environments. According to Mary Ainsworth's attachment theory, this behavior is most consistent with which attachment style? A. Avoidant attachment. B. Secure attachment. C. Ambivalent/resistant attachment. D. Disorganized attachment. Answer: C. Ambivalent/resistant attachment. This question tests knowledge of attachment theory, specifically Mary Ainsworth's styles. The child's behaviors, being very attached, crying excessively upon separation, and reluctance to explore, are characteristic of an ambivalent or resistant attachment style. These children often show distress when the caregiver leaves but are not easily comforted upon their return, sometimes displaying anger or resistance. In contrast, securely attached children are distressed but easily comforted, and explore confidently. Recognizing attachment styles helps social workers understand relationship patterns and guide interventions. When a child is clingy yet not easily soothed upon reunion, consider ambivalent attachment. Question 20. A social worker is facilitating a therapy session where a client, discussing a traumatic event, suddenly changes the subject to something trivial and unrelated. The social worker recognizes this as a coping mechanism the client is using to avoid distress. This behavior is an example of A. Reaction formation. B. Suppression. C. Dissociation. D. Intellectualization. Answer: B. Suppression. This question asks to identify a defense mechanism in the context of therapy. The client's conscious act of changing the subject to avoid discussing a painful topic is an example of suppression. Suppression involves consciously pushing unwanted thoughts or feelings out of awareness. Unlike repression, which is unconscious, suppression is a deliberate, though not always fully acknowledged, effort to avoid confronting difficult material. For instance, a client might intentionally shift focus away from a painful memory. Helping clients understand suppression can be a step towards processing difficult emotions. Question 21. A client reports feeling a persistent sense of dread, worry, and tension for the past 8 months, even when there's no clear trigger. They also experience physical symptoms like muscle tension and difficulty concentrating. These symptoms are most consistent with a diagnosis of A. Panic disorder. B. Specific phobia. C. Obsessive-compulsive disorder, OD. D. Generalized anxiety disorder, GAD. Answer, D. Generalized anxiety disorder, GAD. This question requires linking a specific set of symptoms to the correct anxiety disorder. The key indicators here are the persistent sense of dread, worry, and tension for an extended period, past 8 months, and the absence of a clear trigger, along with physical symptoms. This pervasive, unfocused worry and anxiety lasting for months is the hallmark of generalized anxiety disorder, GAD. Unlike panic disorder, which involves sudden, intense panic attacks, GAD is characterized by chronic, free-floating anxiety. Look for chronic, unfocused worry as a key sign of GAD. Question 22. A social worker is preparing for an initial meeting with a family that includes parents and 2 adolescent children. The referral indicates significant communication breakdowns and frequent arguments. What is the most important principle for the social worker to keep in mind during the first family session? A. Immediately identify the problem child to focus interventions. B. Establish rapport with all family members and understand their perspectives. C. Provide direct solutions to resolve their conflicts quickly. D. Focus solely on the parents' concerns, as they are the primary referral source. Answer, B. Establish rapport with all family members and understand their perspectives. This question highlights a fundamental principle in family social work, particularly during initial engagement. The most important principle in the first family session is to build trust and rapport with all family members and to gather each person's unique perspective on the family's challenges. Rushing to solutions or focusing on one member's view will likely alienate others and hinder the therapeutic process. For example, ensuring each family member feels heard helps them feel valued and increases their engagement in treatment. Always prioritize building inclusive rapport and understanding diverse viewpoints in family work. Question 23. A social worker is working with a client who is prescribed lithium for a mental health condition. The social worker understands that this medication requires regular blood tests due to its narrow therapeutic index and potential for toxicity. Lithium is primarily used to treat A. Schizophrenia. B. Major depressive disorder. C. Bipolar disorder. D. Generalized anxiety disorder. Answer, C. Bipolar disorder. This question tests knowledge of specific psychotropic medications and their uses, especially those with particular monitoring requirements. Lithium is a mood stabilizer and is primarily prescribed for the treatment of bipolar disorder, specifically to manage manic and depressive episodes. The mention of regular blood tests is a crucial clue, as lithium levels must be carefully monitored to prevent toxicity. Understanding the specific uses and risks of medications like lithium is vital for social workers supporting clients receiving psychopharmacological treatment. When you see lithium, think bipolar disorder and blood monitoring. Question 24. A client, a single mother of 2 young children, reports feeling overwhelmed and isolated. She expresses difficulty balancing work, childcare, and household responsibilities, leading to significant stress. What is the best initial resource the social worker could connect her with? A. A career counseling service to find a less demanding job. B. A support group for single mothers in the community. C. Individual therapy to process her feelings of isolation. D. Respite care services for her children. Answer: B. A support group for single mothers in the community. This question focuses on identifying the most appropriate initial resource to address a client's specific needs, particularly when dealing with feelings of overwhelm and isolation due to practical life stressors. A support group for single mothers would directly address her feelings of isolation, provide a sense of community, and offer practical peer support and shared coping strategies, which is often the most empowering initial step. While other options might be helpful later, connecting her with peers who share similar experiences offers immediate social and emotional support. For example, hearing from other mothers that they face similar challenges can normalize her experience and reduce feelings of being alone. Connect clients with resources that directly address their stated needs for connection and practical support. Question 25. A social worker is reviewing the case of a 4-year-old child who frequently engages in temper tantrums, often lasting for extended periods and occurring daily. The child struggles to manage emotions and reacts intensely to minor frustrations. This pattern of emotional and behavioral dysregulation is most consistent with early indicators of A. Conduct disorder. B. Disruptive mood dysregulation disorder, DMD. C. Separation anxiety disorder. D. Oppositional defiant disorder, ODE. Answer: B. Disruptive mood dysregulation disorder, DMD. This question assesses knowledge of childhood behavioral disorders and their diagnostic features. The key indicators are persistent and severe temper tantrums, emotional outbursts that are disproportionate to the situation, occur frequently, daily, and manifest as chronic irritability or anger between episodes, especially in a young child. These symptoms are highly consistent with disruptive mood dysregulation disorder, DMD, a disorder characterized by severe recurrent temper outbursts and persistent irritable or angry mood between outbursts. While ODD also involves defiance, DMDD specifically highlights the chronic, severe emotional dysregulation. Look for chronic, severe temper outbursts and persistent irritability in children as a strong indicator for DMDD.